Our speaker for today's club meeting is Dr. Lakshmi Rao. And to introduce Dr. Lakshmi Rao, I want to invite Sridevi Ganti, the chair of our membership services. Please, Sridevi Garu.
Thank you, Raj Garu. And thank you, District Governor Greg. That was really very inspiring to hear about Malcolm. Thank you very much for sharing that. So Dr. Lakshmi Rao, I would just give a brief introduction about her. So Dr. Lakshmi Rao went to medical school at Siddhartha Medical College after completing her bachelor's in science in Andhra Pradesh, India. She completed her residency in psychiatry at St. Elizabeth's Hospital in Washington, D.C. She started working for the federal government soon after at Fort Belvoir Community Hospital, which is a sister hospital of Walter Reed Army Medical Center. She became the chief of psychiatry and chief of addiction medicine in 2011. She decided to step down in 2013 and is currently working as a supervisory psychiatrist. She also works as a consultant at the Alexandria Community Services Board, where she treats underserved communities for a variety of conditions, particularly psychotic disorders and alcohol addiction. Her hobbies and interests include gardening, cooking, traveling, and spending time with her family. On behalf of Rotary Club of Silicon, Andhra, I welcome you, Dr. Lakshmi Garu.
Good evening, everybody. I want to talk about depression because it's a very common mental disorder, and it affects more than 264 million people all around the world. And it affects different age groups, and it's one of the leading causes of disability. The cost of treating depression is much less than the cost of not treating depression. And depression has to be treated because if there's one family member that suffers from depression, it affects the entire family. And depression can lead to suicide. We have effective pharmacological treatments for moderate to severe depression. The prevalence of depression in a 12-month period is approximately 7%, and it is in the age group of 18 to 29, it is threefold higher than individuals over 60 years. When it comes to males to females, in females, the ratio, the females to male ratio is 3:1. The numbers are high in females compared to males. Depression can affect and appear at any age. Next slide, please. Symptoms of depression. I want to spend more time on talking about the symptoms of depression because it is important to recognize the symptoms of depression so that it can be treated effectively. The first being mood. Usually when they come in, they talk about feeling sad, having crying spells or crying jags. Some don't like the word depression, and they'll just say, oh, I just feel low. I just feel blah. I'm not sitting in a corner and crying. I don't think I'm depressed, but I just feel blah. They don't like using the word depression. Second is they start losing interest in doing things, something that they were interested in before, like enjoying sports, watching a football game, watching a basketball game. They may just do it mechanically, just watch because they're used to watching it with the family at the same time, like football or watching the final games. They just watch mechanically, but they don't derive any pleasure out of it. Then appetite. The appetite can usually go up or down. People tend to lose weight. And so we usually ask them, has there been any recent weight loss or weight gain? Because there can be weight gain also. Usually we see that in atypical depression and in bipolar depression too, where you can see some weight gain. The next is sleep. They do have trouble either falling asleep, staying asleep, frequent awakenings, waking up early in the morning, having trouble going back to sleep, and feeling very fatigued the next day. Next is psychomotor agitation or depression. It's not subjective feelings, but feeling like they tend to pause before a sentence. They feel slow. They kind of slow in their movements. They kind of very slow while they talk. Usually, they don't speak. They speak one-word sentences, and they slow down. Or at times they're agitated and they're wringing their hands, and they get agitated at times. Next is fatigue. They feel very fatigued, and it's called unexplainable fatigue because they do not have any medical causes for fatigue, but they still feel fatigued. They're able to walk, they're able to go up the stairs, and they're not panting for breath, but they still feel very, very fatigued. The next is feelings of worthlessness, or having a low self-esteem and feelings of guilt. And sometimes the guilt is, we call it unexplainable guilt, feeling guilty for reasons that are not reasonable. And sometimes it can be up to delusional proportions, feeling like they're responsible for something happening in the world. So that is delusional proportions, or that, and we'll come to psychotic symptoms later. The next is a lack of attention and concentration. Due to fatigue, they have trouble with attention and concentration, and they come to us saying that they're losing their memory. They think they're getting dementia. They're going up the stairs to find the keys, and they forget why they went up the stairs for. They're losing the keys. They're missing things. They're not able to focus at work. It's taking longer for them to complete a task, and they feel like they're not as smart as the others. The next is suicidal ideations. Some of them have fleeting suicidal ideations. Some of them have suicidal ideations with a plan. They make arrangements for their family. They try to put things in order. And some of them have a plan to hurt themselves. And if you ask them, they will tell you. They will tell you yes. And they're glad that we asked them about it. So these are the symptoms of depression. And the next slide. Yeah, we have the types of depression. Major depressive disorder is where you have these symptoms of depression that are kind of intense for a period of 2 weeks. And they can be the mild, where the symptoms are manageable and they are functional. It could be severe, where the symptoms are not manageable and they're not able to function. They can occur with symptoms of anxiety. They can have psychotic symptoms along with depression. What are psychotic symptoms? Psychotic symptoms are where they lose touch with reality. They have auditory visual hallucinations. They also have delusions. So you can have atypical features. Atypical features is where they have increased appetite and weight gain. And usually you will see that those usually are probably the budding bipolar disorder patients. And then there's some that develop melancholic features where they're very despondent and very slow in their movements, total loss of interest in doing things, and very melancholic in the approach to life. Then we have persistent depressive disorder. We used to call it dysthymia before. Persistent depressive disorders where people have depression that lasts for about 2 years. They have depression on and off for about 2 years, but they're usually pretty functional. They're like functioning alcoholics. They're very dependent, but you will see that they usually feel that they're not functioning to their full potential. They work longer hours because they are unable to get the job done on time. And persistent depressive disorder can develop pretty early on in life, usually before the age of 21, or after the early onset would be before the age of 21. Late onset would be after the age of 21. And usually you will see that in children who have lost a parent or separated from the parent between the age of 7 and 7 and 18. Premenstrual dysphoric disorder is seen in women. It usually occurs 1 week prior to the menstrual period and resolves a couple of days after that. We treat that with antidepressants also, and we actually, I'll talk about more when we talk about the treatment for depression. Then we have substance-induced depressive disorders, where any kind of substance can induce depression, the most common being alcoholic and other illicit substances that can cause depression. So usually when we diagnose somebody with depression, we have to rule out a substance-induced mood disorder before we diagnose them with depression. Then we also have depression that are caused by other medical conditions, for secondary depression, the most common being anemia. In people with anemia, they're so fatigued and can present like depression. And so also hypothyroidism that can present like depression. There are 2 other conditions, Parkinson's, multiple sclerosis, and dementia, where the first symptom might be depression. Next is bipolar depression. Bipolar depression is where you have people who may have depressive episodes and later on develop a manic episode. A manic episode is where the opposite of depression, where they feel very grandiose, very elated, expansive mode. Again, the difference, we have hypomanic and manic. Hypomanic is a lesser degree compared to mania. In mania, they feel very grandiose, high energy levels. They can even become to grandiose, delusional at times, increased goal-oriented activities, increased energy levels. But usually these manic symptoms last for about a week or so, and then they go into a depressive episode. The depression in bipolar disorders is really severe, and the suicide rates are much higher in bipolar disorder patients compared to major depressive disorder patients. And in the news, we have heard about Anthony Bourdain and Robin Williams. And you might think, well, they had everything in life. They had, why did they commit suicide? Like I said, in bipolar disorder, the rates of, when they go into a depressive episode, it is pretty severe, and the suicide rates are much higher in bipolar depression compared to other depressive disorders or even schizophrenia. Dysthymia is same thing as persistent depressive disorder. That was the DSM-4. We used to call that dysthymia before. Seasonal affective disorder. We don't call it seasonal affective disorder anymore. It is just one of the types of, one of the specifiers of depression. Usually major depressive disorders start during the winter months, and they do occur during the other times of the year too, but you will mostly see them in the winter months, especially in bipolar depression. And they usually tend to resolve in the springtime. Postpartum depression. The onset could be postpartum. 90% of the women develop postpartum blues for about a month after delivering the baby. If depression persists after that, we call that postpartum depression. And usually postpartum depression is very high in people with bipolar depression. And you will see a lot of suicide during that time. They develop, because of they develop psychotic depression. The suicide rates are very high. Okay, the next slide, please. Yeah, we have conditions coexisting with depression. We have generalized anxiety disorder, obsessive compulsive disorder, post-traumatic stress disorder, and panic disorders that can coexist with depression. The substance use disorders and anxiety disorders are more common in persistent depressive disorder compared to other types of depressive disorders. Next slide, please. Yeah, causes for depression. It can it can be hereditary. If there's a family member, first degree relative, there's a 3 to 4-fold rise in the possibility of developing depression. Of course, trauma, any kind of trauma, physical, sexual, emotional trauma can cause depression. Environmental factors can also cause depression. Like I said, if there's a loss of a parent or separation from a parent between the age of 7 and 18, you will see that they develop persistent depressive disorder, and they tend to develop chronic depression. Environmental factors do play, neglect, a lot of other stressors, environmental stressors, like lose family problems and other environmental issues can cause depression. Social and cultural factors. If you see, there is a lot of very differences among the different cultures, but the instance of the women are more affected than men across the difference. Women are affected more than men among all the cultures. But the course of the disease is the same among all the cultures. Next slide, please. Treatment. I will first talk about the medications and then go into therapy. We have different kind of antidepressants for the treatment of depression. The first, we have the SSRIs, the serotonin specific reuptake inhibitors, and the serotonin and SNRIs, and the serotonin and norepinephrine reuptake inhibitors. These are the newest antidepressants that we have. The older ones are the tricyclics and the MAOIs. We no longer use the MAOI inhibitors because of a lot of dietary restrictions, and we no longer use tricyclics too, but we do go back to them when the newer antidepressants do not work. And then we have electroconvulsive therapy. When the antidepressants do not work, we do resort to electroconvulsive therapy. Electroconvulsive therapy is much more sophisticated than it was many years ago. And you will see that within a week, you will see an improvement in the symptoms of depression. And usually how it is done is it is given 3 days a week for about 6 to 8 weeks. And then they have monthly treatments for a couple of months, and then tapered off of it and continued on the antidepressants. We have transmagnetic stimulation, which we use. That does help some, but not as effective as ECT. And then we have, usually along with antidepressants, we do combine therapy. The combination of therapy and antidepressants work better than either one alone. But sometimes when the depression is severe, it is best to treat them with antidepressants and wait for some of the symptoms to improve and then refer them for therapy, because otherwise they're not able to engage in therapy. And we have different kinds of therapy, to name a few: cognitive behavioral therapy, interpersonal therapy, dialectical behavioral therapy, to name a few, mindfulness. A lot of these therapies do work very well. People have to believe in it. They do work very well. And of course, lifestyle changes. We do recommend 20 to 30 minutes of exercise every day. Diet, exercise, and avoid substance use. Lifestyle, it comes down to lifestyle. Early to bed, early to rise. Keeps the mind healthy, wealthy, and wise, still holds good. An apple a day keeps the doctor away, still holds good. The diet is very important. Exercise is very important. And so it comes down to lifestyle, learning to reduce stress for oneself. In depression, they tend to isolate themselves. So having family supports is very, very important. Having some hobbies and having some is very important. So it is very important to treat the depression. And I want to touch on some of the cultural aspects for postpartum depression. In postpartum depression, you will see in India, They usually have the mother come in and come in a couple of months for couple of months earlier, have the baby shower, and then take the girl home for delivery, and then bring them back after 2 or 3 months. Nowadays, times have changed. So that is not possible because everybody, women are working too, and they can't take so much time off for delivery. But what happens is when you have that support systems postpartum, you're preventing a major depressive episode. Because once the woman delivers, it takes about 6 weeks for all the hormones to come back to normalcy, and then the uterus to get back to its original shape. So those 6 to 8 weeks is very important to have adequate supports to prevent a major depressive episode. And so we see that in the Indian cultures where we have a lot of help before the delivery. And I think it is very important for that to happen. So I tell my patients to have adequate help before when they get ready to deliver. I tell them, have the mother come in and then the mother-in-law, have them not come in at the same time. So you have help for 4 weeks at a time, or whatever time they want to come and spend with you. And not worry about how they did things for you. Let your mother-in-law do whatever she wants. Don't worry about she didn't do this or she didn't do that. You can set things back the same way once she leaves, but make sure you get the help that you can. And then maybe get some help for babysitting, get additional help for cleaning so that you have adequate support systems and prevent a major depressive episode. You also see that in the Greek culture where they do that, I believe, for a month at a time. It is very important to have good family supports, good friends, and have hobbies and let's say lifestyle changes, diet, exercise, yoga. All these things are very important for relaxation, for maintaining a stress-free lifestyle and preventing depression. Yeah, I work in the military, so people seek treatment much earlier than people on the outside, and because they have to function, and so they seek treatment. But people usually do not seek treatment. They usually go to see the primary care physicians, and the primary care physicians may not recognize the symptoms. I mean, even if they may not start the patient on an antidepressant, they refer them to a psychiatrist. But for us, in the Army hospitals, they are very well trained to treat depression. And so they usually start them on their medication and then send them to us. Why does depression have to be treated? It is a treatable condition. And like I said, if it affects the entire family if the individual is not treated. If you have any questions, I can answer.
Doctor, thank you very much. That was very wonderful. And then, it answered a lot of questions for many people. And so, you touching base on the cultural aspects, and then, the postpartum, and these are all very real time, and we see, in very much across, everywhere. So thank you for taking time and coming and attending our meeting, and giving this discussion on this very important topic. So please, participants, if you have any questions for Dr. Lakshmi Garu, please raise your hand in the participants panel, and you can, and I will ask you to unmute yourself and ask the question. So you can go to participants panel and raise the hand. Okay, Ramesh Hariharan Garu, please go ahead, sir. Our past district governor.
Dr. Lakshmi Rao Garu, that is a very nice presentation, very lucid. I'm sure we're getting this question quite a lot with this COVID What is the effect of COVID on this depression, and what are your thoughts on that? How do we counter that, and any pieces of advice?
COVID has affected a lot of families. A lot of people have lost their jobs. It has become very difficult for families because they are working from home, and they have, the kids are they're doing online schooling. So it's very difficult for them to juggle everything. Like I said, I work in the military hospital, so we have not seen people losing their jobs. But on the outside, yes, people are losing their jobs, and it's very, very stressful. And one of the major stressors that can trigger depression, anxiety, yeah, it is affecting everybody across the board. And like I said, you need to have adequate support systems in place. Friends are important, family is important. It is very important to have adequate support systems in place. And like I said before, we all used to stay very close to family. We had people to help with babysitting. We had people to help us. But now everybody is away from their family. They're moving all over the world, and so they don't have adequate, they don't have families around them. The friends become your family. It's very important to have good support systems. That's very, very important. To have hobbies, also to be very involved in your community, so that you can, in depression, you tend to isolate yourself, so you burn bridges and you don't tend to maintain relationships. So it's very important to have good relationships with your friends and family and maintain those relationships.
Thank you, Lakshmi Garu. Thank you.
From a Rotary perspective, I think we have Rotary, which is a fellowship and community-based organization. I hope that this is helpful for people to also counter things like depression and counter the problem that we're all going through this COVID crisis.
Thank you, Ramesh Garu. And the next question is coming from Sim Gopalan. Sim, please unmute yourself.
Yeah, thank you. I think I am unmuted.
Yes, we can hear you.
Okay, yeah, sure, thank you. Thank you very much, Dr. Lakshmi. It was really an enlightening session. I have a question about people suffering from something like schizophrenia. They find it really difficult to convince them to go to a doctor. And so how do we typically deal with such situations?
Schizophrenia is a thought disorder where they have, they lose touch with the reality. They have auditory and visual hallucinations and delusions. And it is very difficult to convince them to go into treatment. That's why you need family supports. Usually what happens is you cannot force anybody into treatment. Usually if they are at danger of hurting themselves or the others, usually that's how they go into treatment for the first time. Usually taken by the police, or the family members call the police, and that's how they go into the hospital, and that is how they get into treatment for the first time. It is very difficult to convince a patient to go into treatment. But once, if you treat the first psychotic episode, and they stay in treatment, they may go into remission if they stay in treatment for a while. More often than not, once the symptoms improve, they do have every medication has side effects. Once the symptoms improve, more often than not, they go off treatment, and they may have another recurrent episode. Once they have recurrent episodes, it is very difficult because the cognitive functioning, there's a decline in their cognitive functioning. So it is very difficult to convince somebody to go into treatment, but usually due to legal issues, they will get into treatment.
Thank you.
Okay, the next question comes from Ushasri. Please unmute yourself and ask the question, please.
Unmute.
Ushasri Garu, can you hear me?
Yeah.
Go ahead, please.
Yeah, hi. This is Ushasri's sister-in-law. I have a question, actually. I was also attending the meeting with my sister. Thank you for presenting it. It's an excellent one. And I just wanted to know about like the therapies about the CBT and DBT. And I also saw something called IPT, something I didn't get a chance to understand what it is. Is there any other therapy for, and also I just wanted to know that if with the depression, if somebody is having a lot of anger and frustration, what are the tips that we can use it to calm down? It's when they are with a lot of anger issues with the depression, when they get into that, some of the scenarios.
Okay. I'll start with the first question. Cognitive behavioral therapy is aimed at, we all have we have a way of looking at life itself. And so we have some of the ways we look at life may not be accurate. We have, so what the cognitive behavioral therapist does is try to correct some of these cognitive distortions. To give you an example, you may tend to see life or things like an all or none phenomena or black and white, and not recognize that you're doing that. So they help you look at it and correct that, that for you, so that you can change the way you look at things, and change your thoughts are something that come to your mind. You cannot change your thoughts. They keep coming to your mind, but you can help understand these thoughts and change your behaviors. So you can change these distorted ways of looking at things, and that will help you change your behaviors and your outlook on life. That's how cognitive behavioral therapy works. It is very, very effective, especially for depression. Interpersonal therapy is focused on interpersonal conflicts, interpersonal relationships, dealing with grief, and how they deal with relationships, and how they can improve that in their life with resolution, conflict resolution, and things like that. Dialectical behavioral therapy is focused on emotional regulation, grounding yourself, regulating your emotions, because we have a personality disorder called borderline personality disorder, where they tend to see things black and white, and they have difficulty controlling their emotions and regulating their emotions. Either once they like you a lot. Once you have said something that they are not fond of, they will dislike you. So it's like a hot and cold, and they have trouble regulating their emotions. So dialectical behavioral therapy is very effective for treating people with having anger problems, emotional problems. Usually when somebody has anger or anxiety, the underlying usually they have underlying anxiety, and that's why they have a lot of anger and irritability. And DBT, dialectical behavioral therapy, is very effective for that.
Thank you, Lakshmi Garu. The next question is from Satyapriya Tanagula Garu. Please go ahead, madam.
Thank you so much, Lakshmi Garu. I do have a question. So how do we differentiate, between feeling disappointed, dejected versus, having a depressive symptom? Because like I often hear even from kids saying that, oh, you know what, I'm so depressed today. So, they tend to use this word in a very regular basis, but it's not that,
Depression.
Yeah,
right.
exactly.
Yeah.
So
Yeah.
that's my
One
question.
of the differential diagnosis of depression, I didn't touch on that because this was only going to be 20 minutes, so I tried to keep it short. One of the differential diagnoses is attention deficit disorder may appear like they have depression. And the other differential is sadness. Some of us all have some sadness in life. Some negative event, we all are going to feel sad. When is it that it becomes a disorder or a depressive disorder? Is it when it affects your social and occupational functioning, and you're having trouble managing your day-to-day life? Then it becomes a disorder and has to be treated. But sadness, it comes and goes. It doesn't have to be treated. It comes and goes. We all experience that in our lives.
Thank you, Lakshmi Garu. Thank you. So I do not see any more hands raised. If there is anybody else have a question, we can take one more question. I know we ran a little bit over this time, but it's a very wonderful topic. So we wanted to accommodate everybody with the questions. One more question we can take if there is one.
Yeah, I think Manikya Valigaru posted on the group chat. Her question is, how can one support a family member with suffering from depression who lives far and sometimes just listening and supporting talk is not enough?
You want to encourage them to go in and seek therapy or treatment. Encourage them to pursue their hobbies, encourage them to maintain contacts, encourage them not to isolate themselves, and encourage them to seek treatment. And that it's a treatable condition. These medications, a lot of them feel that, how can medication help me? My situation is not going to change. I still have the stress in my life. I have lost my job. My relationship has failed. I failed in an exam. How is medication going to help me with that? Medication is not going to help with your situation, but it's going to help because of the stress it has caused your body and how it has affected your body and how it affects. Depression is a complex condition that affects multiple systems. It affects your sleep. When it affects your sleep, it does, when your sleep architecture is affected, it starts affecting your energy levels. It starts affecting your attention concentration. And then it affects you have trouble making simple decisions in your life. Like what should I have for breakfast? What should I wear today? You have trouble making simple decisions in life. That's when you know it has to be treated. You're having trouble paying your bills on time. You're trying to procrastinate. And slowly you're multiplying stressors for yourself. You tend to miss looking at a red light. You may get a traffic ticket. You may not pay your bills on time. You multiply your you increase your financial stress. So things like that happen, and you're just multiplying things for yourself. So it has to be treated. Depression has to be treated. When it is affecting your day-to-day functioning in life, it has to be treated.
Thank you, Lakshmi Garu. So it was wonderful to have you here today. We will continue. So all the Rotarians and anybody else who is a non-Rotarian of the Rotary Club of Silkanandra, please get involved, be active in the club. We are doing a wonderful work here, as you have seen. So we need your inputs, your thoughts, and your ideas to keep the club going and serving the community, not only here locally but also across whether it's in India or other countries. So we are very much open to learn more about your ideas and see if there are any opportunities for us to serve, to address those concerns. So connect your friends, colleagues, relatives, and neighbors to the club. Any ideas you have, please send them to me, raju@silkanandrarotary.org. And let's all work together for a better tomorrow and a better world. So next meeting we will have on October 4th, the first Sunday, same timings, 5:30 p.m. Pacific. So before we close the meeting, I would request our Secretary, Rotary Club of Silkanandra, Srimati Ratnamala Vanka Garu, to give the vote of thanks, please.
Thank you, Raju Garu. Good evening, everyone. I'm privileged to deliver the vote of thanks today. Thank you, respected Governor, District 5170, Greg Giuliano, our past President, past Governor, Ramesh Hariharan Garu, our past President, Anand Kuchpatla Garu, Mr. President Raju Chamarthi, President-elect Priya Tanagula, other distinguished guests from the district and other clubs, and our leadership team and friends from other quarters for attending this last meeting of the first quarter 2020, and also a very interesting session on depression encompassing all age groups by Dr. Lakshmi Rao. I'm sure you all agree that this is very much the need of the hour. Thank you, Dr. Lakshmi, for your valuable time this evening in educating and enlightening us on the different forms of depression and also how to deal with, patiently answering our questions as well. All of you, stay safe and clear of all COVID dangers, and looking forward to seeing you at our next meeting. Stay tuned as we bring in very exciting things. Good evening.
Thank you, Ratnamala Garu. Really appreciate that. And I want to thank everybody who were able to attend the meeting today. We will certainly, post this on our YouTube channel in the next day or two. So please go there, check out all the videos, subscribe to our channel, spread the word, and join the Rotary, and let us do great things. We are all ordinary people, but let us do some extraordinary things, and we can do that as long as we stay together, get connected, and so thank you.